Do you know that the majority of our harmful cultural and traditional practices are targeted towards women and children? So I'm touching a very sensitive topic today, cultural and traditional practices. Now, what are cultural and traditional practices? Cultural and traditional practices are simply a reflection of the belief and value system of members of a particular community, and this usually spans for generations. Now, whenever we hear about cultural and traditional practices, we usually think of it in a negative light, but it's not usually all bad. It also has some good side to it. Okay, so cultural traditional practices can be negative and then it can be positive. Now, let me start with a positive note. Now, what are some of the positive or good cultural and traditional practices that we have? We have things like circumcision, which helps to reduce STIs. We have things like the frown against consumption of alcohol. This helps to reduce liver diseases. We have things like and yes, taking of alcohol, because it is frowned upon, it has health benefits on both mother and child. Because if a woman is pregnant and is taking alcohol, it means that her child can have fetal alcohol syndrome. Okay, we have others like what we refer to as wankan jego in Hausa, where if a woman gives birth, she stays at home for about 40 days and she's well taken care of. So these are all positive things. Okay, another thing is how we value chastity in our community. Now, because we value chastity, it helps to reduce the number of STIs in our community. So it means that traditional practices are what can be good, but then it can also be bad. Now, what are some of the harmful traditional practices that we have? So now, on the negative part of our cultural and traditional practices, we have so many of them. Examples are having local episiotomy, electomy, that's chiri erwiya da ake yi dinnan. We have these hot traditional parts that women usually have after they give birth. We have things like taking of kunun kanwa, this pap that is made from potash. We have other ones like early pregnancy. We have things like food taboos. We have gender-based violence. We have female infanticide and practices surrounding child delivery. Now, there are so many, and I can make this into a series where I talk about each and every one of these negative aspects that I've mentioned of traditional practices. But for my discussion today, I'm going to only focus on one, which is the harmful practices surrounding child delivery. Harmful practices surrounding delivery, labor and delivery. So now to the harmful practices surrounding labor and delivery. The most common one is not allowing women to go for ANC. In some regions, they'll tell you that when a woman is pregnant, that she should not go out during the day. And it is during the day that you have ANC. So how is she supposed to get information surrounding the do's and don'ts of pregnancy and then what she's supposed to do during delivery? Another one is with early pregnancy, there's a high likelihood of having things like obstructive labor. If you're pregnant before the age of 18, it increases your chance of having obstructive labor. And with obstructive labor, it puts you at risk of having VVF, that's vestibulovaginal fistula. And you can have things like infections if you didn't go to the hospital to give birth. Maybe you're left at home with a traditional birth attendant that is not well skilled. Maybe you require, let's say, like local episiotomy, and it can put you at risk of bleeding and infection. Another one is that it puts the baby at risk of being born premature and being born underweight. Another one is the food taboos surrounding pregnancy and delivery. You hear things like if a woman is pregnant, she should not take things like eggs. If she eats egg when she's pregnant, that her child is going to become a thief. I mean, like, it psychologically harms women. That are mostly affected are women in rural areas because we don't have enough skilled health staff on ground because of the JAPA issue. And the ones that are around there, mostly in the urban area, left with traditional birth attendants who don't have any formal training. If there's any obstruction in labor, where you have to get, let's say, for example, this local episiotomy, you're left with infection, you're left with bleeding, you're left with trauma. If you're able to survive this, it psychologically harms you. Because most of them usually die from those procedures and those that actually survive it, they are psychologically traumatized. Another practice is what we refer to as zuru. I don't know what zuru is in English, but this practice, what they usually do is that when have to talk about is the use of aphrodisiacs. If you have finished surviving the pain of pregnancy and delivery, then there's now aphrodisiacs. That has now become so rampant. Do you know what this does to you? It destroys the natural bacteria that is supposed to protect you. And it puts you at risk of developing infections and puts you at risk, increases your risk of getting STI. So a word is enough for the wise. I hope that we stop these harmful practices because majority of them are targeted towards women and children. Thank you very much for listening to my talks.